Right. The next question is close to my heart, so we'll give her...
My name is Vicky Canalisi and I have a background in nursing. With regard to the retraining of nurses who have been out of nursing for an extended period of time, many nurses have left nursing to have a family, and as I'm sure you are aware, they now have to retrain for 12 months in Sydney at a cost that many of them can't afford. There are three problems. One is the cost of the course and the cost of living in Sydney for 12 months. Then there is the time, the 12 months away, and then there is the fact that they're being removed from their family and often young children. At a time when we need more nurses to come back into nursing, these factors make it very difficult, if not impossible, for rural and remote nurses to retrain. So what I want to know, are there any plans for this to change, and if so, what changes?
Thank you. You're right, nurses are very, very important to us right through the system, and can I say I've been really pleased to be able to welcome the new graduate nurses that have just joined our hospitals this last week or so. We have over 2,100 new graduate nurses starting in this month, which is absolutely fantastic. But you're right, we want to enable all people who've done nurse training to come and work in our hospital system. There are, for those who have been out of the workforce for some time, we're talking registered nurses. For those who've been out of the workforce for less than 5 years, which is most likely those that have been taken time out to have families, they can register through a Nurse Reconnect program, where they do that at their local hospital. They don't need to go to Sydney. For those who have been out of the workforce from 5 to 10 years, they do need to do retraining. It's not 12 months, it's 8 weeks, and 4 weeks of that is actually offered through the College of Nursing in Sydney. Now we're trying to come up with alternatives that would make it more available for people in the country, but they are the only accredited provider. We don't, the New South Wales government doesn't do this. This is a national requirement to do with the national registration. It's called recency of practice. And the College of Nursing is the only agency that has put its hand up in New South Wales saying that they're prepared to do this training. We've asked universities, we've asked others, they're the only ones. The cost is $10,000, in acknowledgement that that is quite a sum for people who've been out of the workforce to find. The New South Wales government is offering scholarships worth $6,000. So we brought it right back as far as we can to make it affordable. Some of those scholarships are still available, so if you know people who would like to have more information about that, please see us later. And you should also know that under the new national registration, there are many nurses that had registration that were not practicing, and under the new scheme they can still retain their registration without having this extra training if they've been out of the workforce for some time, if they don't intend practicing. So they can have their registered nursing qualifications recognised, but it will be a non-practicing recognition. And I know a lot of nurses are very proud of their background as registered nurses, and they want that. So there are lots of different options, and I believe that we're trying to accommodate all those that we can, and I look forward to many of those nurses who've been out of the workforce coming back, because it's those experienced nurses that are going to be very important in helping the newer graduates come on board. So thank you for your question.